Hi guys, how are you doing? I hope you are doing well and welcome to today's episode of learning. Today I want us to discuss about antenatal clinics. Okay? So once a lady has found out that they are pregnant, um, they are advised to immediately start on follow-up with the antenatal clinics in the hospital, and this is throughout the pregnancy journey, so that you can be able to, so that the doctors will follow up on with you, so that you can, so that just in case of any complications that can arise during pregnancy, they will be able to be detected early and they will be solved. Okay, so what is antenatal clinics? This is a care you get from a health professional during pregnancy. Antenatal care is the care you get from healthcare professionals during pregnancy. Uh, uh, Nowadays, it used to be called antenatal clinic. Nowadays, it is called focused antenatal clinics, and this one aims at 4 visits throughout your pregnancy journey, but it can change depending on the complications that may arise during pregnancy. Focused antenatal clinics aims at 4 clinics, okay? But then if maybe a complication arises, this can change, okay, depending on the complication, and you might end up being given more visits or frequent visits to the hospital, so that the doctors can keep an eye with your pregnancy. Okay, yes. So the first visit is expected between 8 to 12 weeks. Okay, between 8 to 12 weeks pregnant, when you are between 8 to 12 weeks pregnant, you are expected to start your clinic. Okay, so during this visit, now it is your first visit. Okay, it is your first contact with your healthcare provider, and I'm going to give you a list of the things that are expected during the first visit in the hospital. Okay, so this visit is to identify, on this first day you get into contact with the healthcare provider. It might be a gynecologist, it might be a nurse, it might be a midwife, it might be a medical officer. Its aim is to identify any health conditions or risks that may require referral. Okay, the first day you come to the hospital, you are pregnant. This day, your doctor will do a full examination to identify if you have any healthcare conditions. You can be pregnant, but you have other underlying health conditions. Maybe you have high blood pressure, maybe you are a diabetic person. Okay, maybe you have asthma, maybe any other illness that you have. This day your doctor will have to identify this illness that you have, so that this one determines the care that you need. Okay, so your doctor will have to do a physical exam, identify the health condition that you have, and that one will help him know the kind of care that you need. Okay, or maybe if you need a referral, if you have a health condition that they can't be able to manage in that hospital, they will give you a referral. Okay, this is very important. You see, this is a very important point. That is why you are required to start your clinic between 8 to 12 weeks. Okay, So if you will be required to do an antenatal care profile. Okay, these are tests that any pregnant woman must do. Any pregnant woman must do this profile. Okay, and most of the time what is checked is your HB. Your doctor will be required to know your HB. Okay, this is very important because during pregnancy, this baby that is growing in your womb, this baby depends on you. Okay, you are the one who is going to supply nutrients and also oxygen. So if you supply oxygen to this baby, that means your HB should be in the required limit. So your doctor will check your HB and know if it is okay. If not, you will be advised on what to do. You will have to do a malaria test. This is mandatory to every pregnant woman because malaria in pregnancy is very dangerous. Okay, so you will do a pregnancy test to confirm that you don't have malaria, and if you have malaria, you will be started on treatment immediately. You will do a VDRL. This is to do a syphilis test. All pregnant women must do a syphilis test to know. This is to make sure that you don't have syphilis. Okay, because syphilis with pregnancy, this puts the baby that is growing in your womb at a very high risk. Okay, I will tell you later the risks that syphilis has during pregnancy. We have HIV test. You have to do an HIV test. This is to know your status. And this one will help. If you are HIV positive, you will be started on treatment, and also you will be taught on how to handle your baby after giving birth. You will be prepared on what kind of medications you need to have for your baby when you give birth, and also you will be taught on the care to give the baby. You will do a urinalysis. This is a test to see if you have any infection. Okay, urinary tract infections during pregnancy predispose women to miscarriages. Okay, so many women have had miscarriages caused by urinary tract infections. So your doctor has to do a urine test to confirm that you don't have a urinary tract infection, and if you have one, you will be treated. Okay, you will do a blood pressure check. Okay, you also do a blood group. You need to know your blood group. Actually, you need to know your blood group. You don't have to be pregnant to know your blood group, but during pregnancy, make sure you know your blood group. Okay, yes. So you will do a total blood count to check on any infections in your blood. Also, you will do a random blood test. Okay, this is to check if you have diabetes. Okay, yes, you'll have to do a diabetes test because there are women who develop diabetes during pregnancy. This is called gestational diabetes. So and if you just don't notice that you have gestational diabetes, there are those risks that you put your baby onto. Okay, so it is good to check your blood glucose to ensure that it's okay. And if you notice that you have gestational diabetes, then your doctor will know the kind of care he will give you. Okay, yes. That is some of the tests that you will do immediately you come into contact with your healthcare provider. Okay, you will start on iron supplements. There are those tabs that you will be given that help to boost your HB. This is because during giving birth, some women lose a lot of blood. So this iron supplement tabs just help to boost your immunity, so that that blood you lose during childbirth won't put you at a risk. Okay, we have you will be the estimated date of delivery will be calculated, so your doctor will be able to help you to know when are you expected to deliver. uh, you will be given a tetanus injection. Okay, during pregnancy you are required to get a tetanus injection to protect you and also your unborn baby. So the first time you come into contact with an healthcare provider, you will be given a tetanus injection, and then you will get another one after 4 weeks. Okay, so always if you go to the hospital or when you are pregnant, just know that you should get a tetanus injection, 2 of them, during your first pregnancy, but then in the subsequent ones you will just be receiving 1 dose. You will be given a mosquito net. All pregnant women are required to sleep under a treated mosquito net. I know in the government hospitals, those pregnant women are provided with mosquito nets, but if you go to a private facility, you might notice that you are not given, but ensure you sleep under a mosquito net throughout your pregnancy journey. And then you will be given a health talk. Okay, about you, those ladies who use drugs, you are required to stop using those drugs during this pregnancy period. So you will be given a health talk. You will be given a chance to ask all the questions that you have that are running in your head. And also I have told you you will start on iron supplements. Okay, those things are the ones you are required to do once you come into contact with your healthcare provider. That means the first time you go to the hospital, all these things you are supposed to do. Okay, in your second visit, your doctor will give you the return date to the hospital, and during the second visit, it will be between 14 to 26 weeks. Okay, the doctor will check to note any changes from your last appointment. You will receive a second dose of tetanus. You will be given a dewormer. You will be given a dewormer. That is if you are 16 weeks plus. Okay, do not take a dewormer if you are below 16 weeks pregnant. But if you are above 16 weeks, you are required to take a dewormer. The doctor will check, the doctor will palpate your abdomen to feel for the growing baby. He will check the heart rate of the baby. He will check for signs of anemia. Okay, I have told you because of the risk of bleeding during childbirth. You will be required to refill your iron supplements. You will ask all the questions that you have to understand your stage of pregnancy, and also the doctor will be able to note, to detect any potential risks and treat them. Okay, that is during the second visit. Sorry. In the third visit, you will be given a return date of when you will be between 28 to 32 weeks. During this visit, the doctor will just carry out the standard checks, your pressure, the fetal heart rate, okay, the signs of anemia, okay, and also he will just point out any potential risks to treat them. We will also refill your iron supplement. These iron supplements, you are required to take them throughout your pregnancy. From the one you notice you are pregnant to the last day of your pregnancy, you are required to take the iron supplements. Okay. The fourth and the last visit will be between 36 weeks to 38 weeks, or to to the day you will deliver. What will happen in this visit? Standard checks, your blood pressure, the fetal heart rate, okay? The doctor, in this stage, your doctor has to identify any risks, and just in case you need a referral, you will be referred, okay? If you that is if you have some conditions that are so risky and they won't be able to manage you in the hospital, you will be given a referral. The doctor will help you to locate the hospital that you want to give birth in. This is the time now you have to decide which hospital do you want to deliver. You will discuss that with your doctor. He will let you know the signs of labor for the first time moms. Ask all the questions. You will be helped to know how can you know that you are going into labor. The doctor will give you all the symptoms, okay? He will give you an opportunity to ask you all the questions that you have, all the advice that you need, and also you will be told all the requirements during childbirth, okay? That is including the clothes, and whatever you need to carry to the hospital when you are going to give birth, okay? So blood pressure is very important during pregnancy. You need to monitor your blood pressure, because we have when you have very very high blood pressures, we call it eclampsia. Eclampsia is when you have dangerously high, very uncontrollable high blood pressures, and this puts a mother and a baby at a very high risk of dying, okay? So that is why you are required to monitor your blood pressure throughout your pregnancy journey. Because I know maybe you have had some women who had gone for emergency cesarean section because of high blood pressures. So when you have syphilis during pregnancy, this infection crosses the placenta barrier, okay? By that I mean it can cross from the mother to the baby, okay? And it will infect the baby, okay? So also it can cause miscarriage. Syphilis can cause miscarriage if not treated. It can lead to a stillbirth. That means you give birth to a baby who is dead, okay? It can bring premature births. You give birth to a baby who is not term. That means the baby who is below 37 weeks. And also congenital anomalies. Who wants to give birth to an abnormal baby? No mother wants to get an abnormal baby. So that's why you must do a syphilis test anytime you are pregnant, okay? So yes, that is a brief discussion, a brief lesson on the importance of these clinics. Have you seen the importance? Okay, yani you are given holistic care. The doctor will identify potential risks. For example, if the doctor finds out that you have very very high blood pressure, now that is when they will try control them. If they are not controllable, that is when they will decide for you to go for an emergency CS to save you and your baby, okay? That is one importance of following up with antenatal clinics, okay? Also, you will ask all the questions that you have. For those new moms, please don't just sit at home. Once you notice you are pregnant, go to the hospital, okay? Go to the hospital and start your clinics immediately. Also, do not forget to take your iron supplements daily, okay? During birth, women die Because of what? Because of hemorrhage, losing a lot of blood. So just in case you have not been taking your iron supplements, your HB has been low, and then during birth you lose blood, okay? Some women die just because of that. So please take note, make sure you take your iron supplements, and also make sure your doctor checks your HB levels to ensure that they are within the normal limits before you give birth, okay? Yes. So that is it for today's discussion. Thank you so much for watching. Thank you for subscribing, and also thank you for sharing, and also welcome back. Let's continue learning.